Morning, everybody. Eric Chaconis here for the PT on Ice Daily Show, and I teach our extremity management course. What I want to talk about today is we just had the American Academy of Orthopedic Manual Physical Therapists conference this past weekend, annual conference, and an AOMP released this PR statement regarding degenerative disc disease and really trying to get people away from using degenerative disc disease as a diagnostic term, or at least not describing it that way to patients, right? So if you go to AOMP's website, it's on the main page right there under latest news, but it's also, if you're listening to this later on, if you go under public resources and then position statements, it's going to live there for a while. So AOMP hired a PR firm to kind of promote this, and hopefully this is going to get out there in mainstream media. And we really, as physical therapists, need to get behind this and understand this and promote it in our circles as well. So I want to talk a little bit about kind of why. So it all comes behind, it all sort of stems from this idea of words that harm and words that heal, right? Most of you are probably familiar with that. And if you're not, look up Susanna Bedell, B-E-D-E-L-L. She's a physician that has written extensively on this in a variety of domains. It's not just musculoskeletal care. It's heart disease and describing, to patients, hey, you're what's going on, the atherosclerosis in your heart, that's like a ticking time bomb, right? Obviously, that gives people a lot of anxiety and can make things very challenging. I experienced this firsthand. I never forget, my wife was when we were just dating, she had breast cancer. She was diagnosed with breast cancer at a young age, 27. And I was out in the waiting room when she was getting a lumpectomy. She was having the surgery, and the surgeon came out, and the first thing out of his mouth was, it's probably spread all over her body. We're going to need to look at her liver. It likely metastasized to her liver and to her bones. She's definitely going to need a bilateral mastectomy. I mean, that's literally the first thing he said. She had stage 2 breast cancer, stage 2, a lump in her breast, and then a few lymph nodes that were involved. And he might have been right. It might have been that it metastasized that extensively, but there's no way for us to know that until the pathology reports come back, right? And she has a PET scan and all the other stuff. And that takes like several weeks. So we spent the next 2 weeks horrified. I mean, it's already scary enough going through breast cancer, but I never forget the level of anxiety and fear and just how bad those 2 weeks were, just because of the words that were told to me by the surgeon right after the surgery, and then again the next morning when she was recovering in her room. So anyway, words matter. Words matter a lot. And in our case, in musculoskeletal care, you think of how often patients are told things like, you have degenerative disc disease. You hear those words, degenerative disease, those are scary words, and they really make you think like, I need to get rid of this disease, right? I need the most invasive procedure possible to get rid of this disease. When in reality, we all know in musculoskeletal medicine, everybody has degenerative disc disease almost, right? I mean, it's like a normal part of the aging process. It's pretty normal for you to lose disc height. Pretty normal for you to lose some of the hydrophilic properties of the nucleus of your intervertebral disc. I would be surprised if I looked at an MRI in a 60 or 70 or 80-year-old and didn't find degenerative disc disease. That would be kind of weird, right? So these are sometimes normal part of the aging process. Some people get it younger than others. And yes, some people, maybe it does correlate with their symptoms, but that's probably not the majority. The majority are probably going to be okay. Back pain is self-limiting. You'll be fine. Stay active, make healthy choices, right? I mean, if you want to participate in an exercise program or rehabilitation, fine, that's great. Not everybody needs to see a physical therapist. That's not, the goal here isn't to recruit more patients for us. I can tell you from firsthand knowledge, being involved in this task force and being involved in AMP, the goal by no means is to recruit more patients. The goal is really to educate everybody, primarily the healthcare community, right? The community of healthcare practitioners, that words like this are harmful. We probably would be better off not using them, And so just spreading that message. And I think you're starting to see that a little bit. You'll see radiologists, when you read radiology reports sometimes, they'll describe things as, characteristics consistent with, normal aging or characteristics, that may or may not be affiliated with clinical symptoms, they always say like clinical, make sure the clinical exam matches up or whatever. They don't say it like that. They say it better, more eloquently than I am right now. But you get the idea. My point is people are starting to recognize this, but we need more people to recognize this. So for those of you on the podcast, let me just kind of read the position statement and hopefully you guys. So it was released on October 25th. Timing is everything. When we're going to promote this, we got to promote this now, right? I think the week that something comes out is that critical time where you really want to blast it and promote it in your circle. So let's just start having a conversation. That's all. And this can lead to the bigger conversation of the difference between placebo and nocebo, words that heal, words that harm, ways that we can encourage people to get better and not scare them. That's really the bottom line. American Academy of Orthopedic Manual Physical Therapists releases position statement opposing the use of degenerative disc disease as a diagnostic term. AOMP urges clinicians to avoid using the diagnosis of degenerative disc disease and comments on the role of physical therapists in preventing exposure to opioids. And the reason for that is we've got some recent studies that have shown, really recent studies have come out in the last few months that have shown that when you do see, and it's not just the physical therapist, it can be, when in the case of manual therapy, it can be a PT, chiropractor, or physician that provides manual therapy. But when you get early intervention, conservative management, that tends to reduce long-term exposure to opioids. So those patients are less likely to be taking opioids over the long haul, all right? So degenerative disc disease is a commonly used term to diagnose an age-related condition that happens when one or more of the discs between the vertebrae of the spinal column changes shape and size. Most of the time it's age-related, most of the time. Some people are diagnosed at a young age. I'll tell you another personal story. I actually had back pain and somewhat of a rheumatic condition when I was like 21. And I had a plain film x-ray taken and I saw a rheumatologist, and the rheumatologist looked at my plain film and said, you've got a loss of disc height. Kind of funny. He actually said, maybe you jumped from like a high level and landed, and maybe that's what caused it. That was his initial potential causal mechanism of the loss of disc height. But anyway, I mean, I think some people perhaps structurally have maybe less disc height, or maybe you see some abnormality between the two levels in the spinal column, and that might be incidental as well and unrelated to age, right? But most of the time it's age related. The degenerative, which was stated by Elaine Loneman. Elaine is the president of AOMP. These changes are a normal process of aging and not linked to a disease. The use of the term disease to diagnose these changes misinforms patients and may lead to unnecessary treatment. We believe that this term does more harm than good. Most of the time, you would agree with that, right? Most of the time, it's age-related. Most of the time, it's normal. And most of the time, it does more harm than good. There are, of course, going to be exceptions, but we want to focus on the biggest component to this problem, right? AOMP recommends that patients seeking care for spinal pain undergo a comprehensive examination to rule out serious medical conditions. Non-pharmaceutical and non-invasive treatments, including physical therapy, should be the first line of care for patients that do not improve initially on their own. In the absence of trauma or other systemic health concerns, practice guidelines indicate that imaging studies for patients with low back pain are not necessary before a thorough trial of conservative therapy is completed. AOMP says patients often react to the label degenerative disc disease by losing hope and seeking more invasive and higher risk treatments. Think about that for a second. The efficacy might be comparable between some more invasive intervention versus conservative care. But what's the risk to benefit ratio? That's really what you have to look at. there isn't a lot of risk in staying active and performing exercises and even maybe going through a course of rehabilitation. There's not a lot of risk there. So there's pretty good benefit, low risk. So that ratio is kind of critical when you think of this topic. They avoid, so again, talking about patients that maybe be diagnosed with this, they avoid beneficial physical activity for fear that exercise and movement will worsen their condition. We all see that a lot, right? We deal with that a lot. Possibly leading to chronic pain. So maybe there's a thought virus that makes things worse. They don't stay active. They're afraid if they move, they're going to get more damage, and that's not true. The majority of spinal pain is self-limiting and can be managed appropriately without the need for medication or risky procedures such as injection or surgery. For those individuals who do need care, AMP supports and encourages early physical therapy instead of high-risk procedures and medication. AMP strongly recommends that clinicians avoid using the diagnosis of degenerative disc disease. We also need to consider the role that orthopedic manual physical therapists can play in addressing the opioid crisis, Loneman says. Opioids are prescribed for back pain much more commonly than physical therapy, although I do think that's getting better, hopefully getting a little better. Physicians might prescribe opioids when alternatively physical therapists could help patients manage their neck and back pain before it becomes chronic. Physical therapists must be a part of the conversation when it comes to the care and management of spinal pain conditions. First-line treatment options recommended by most clinical practice guidelines can be effectively delivered by a physical therapist. Orthopedic manual physical therapy is a specialized area of physical therapy practice that uses advanced clinical reasoning to determine the most effective patient management approach, then integrates hands-on skilled manual techniques, targeted exercise, and education to optimize outcomes, including reduction in pain and improved function. So and then we'll have a white paper that kind of elaborates on all the different components of this that'll be coming out shortly as well. And that's really all I have today for you. I think that this is an important concept, and even if you're not, I think some people, I've heard a few people through social media kind of not really agreeing with some parts of this. That's okay. I mean, I think if you don't agree with this, if you have a really strong point that you want to get across, you message me. You can message me through the ICE platform. You can message me on Facebook, and I am happy to look at your concerns, your consideration, and relay those. But I think that this is an important concept. Words matter. Words that hurt clinical outcomes. They definitely can make patients more anxious and more fearful. And in the end, that becomes more of a challenge. So we should need to use words that heal and phrase things in a really positive manner. What I'm looking at on your MRI is pretty consistent with what I see in most patients that are of the same age and activity level that you are. And I think, most of the time back pain is going to go away. You're probably going to be feeling better a few months from now. We just got to keep you active and keep you healthy and keep you moving. So there's a lot to just advice and education and encouragement and reassurance to helping people really make the best healthcare choices. All right. Thanks, everybody. Take care.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.